Hi, everyone. This is Professor Widener going over Chapter 12, Skeletal Muscular Function. This system consists of bones, joints, muscles, ligaments, tendons, and connective tissue, and their main job is to provide support for the body and protect its vital organs. It also plays an important role in homeostasis with the storage of calcium and other minerals. Additionally, hemopoiesis occurs in the bones, and connective tissue is the biological material that binds tissues and organs together. Disorders can either be acute or chronic, and they may also be congenital, genetic, autoimmune, traumatic related, a nutritional deficit, or excessive use. Skeletal muscles are the only muscle group that are controlled consciously, while cardiac and smooth muscles are controlled unconsciously. Bones are a specialized form of connective tissue. The bone is a living and metabolically active. We have a total of 206 bones in our body in all shapes and sizes. Its job is to provide support and protection for vital organs such as the heart, lungs, and brain. There are 5 types of bones. Long bones have an epilysis at each end with growth plates. Both ends are covered in cartilage to protect the bone by reducing friction and absorbing shock. Examples of these would be the femur and the humerus, but there are also small bones, such as the phalanges that are in the finger that are considered long bones. Short bones are wide as they are long. Their primary function is to provide support and stability with little movement. Those include the ankle and the wrist. Flat bones are strong, level plates of bone that provide protection to the body and vital organs and serve as a base for muscular attachment. In adults, most red blood cells are formed in the flat bones of the scapula, sternum, skull, pelvis, and ribs. Irregular bones are non-uniform in shape. They don't fit anywhere else, and examples of these would be the vertebral column, the sacrum, or the mandible. Finally, the sesamoid bone are short and irregular bones. They're embedded within a tendon, such as a patella and some of the bones around the base of the metatarsal. The periosteum is a layer of connective tissue that covers compact bone surfaces. It serves as the muscle attachment via tendons. It is full of nerve fibers. Going back to talk a little bit about the bones, inside the shaft of the long bone is a large cavity for bone marrow. When we are born, the bone marrow is mainly red in fetus and newborns and serves as a site for hemopoiesis. As humans age, the red bone slows down and is replaced by fat-containing marrow, which is called yellow marrow. And this is present in most bones by adulthood. In adulthood, hemopoiesis occurs in the vertebral, pelvis, and a few other sites. The yellow marrow can be reactivated under certain circumstances, such as injury or trauma. Bone remodeling is continually happening in the body to repair aging bones, fractures, and it also adjusts to activity levels. If you look at figure 12.7 on page 575, it gives a good example in a picture form of the bone remodeling. There we have the osteoclastic type cells that reabsorb and then rebuild with osteoblast. The osteoid contains two substances, collagen and ground materials that make up the bone matrix, known as the osteoid. That is what continues to be remodeling. This is controlled by the cytokines, which are growth factors, hormones, and OPG, osteoprotein glycerin, which is a key mediator of osteoblastic and osteoclast activity. Vitamin D also plays an important part in bone metabolism. The bone matrix has osteoclasts in the extracellular material. There is a balance between mineral components and collagen and is necessary for optimum bone functioning. Several hormones influence bone structure. Growth hormones are produced by the anterior pituitary glands. They work with the thyroid hormones to control normal bone growth. Calcitonin, which is from the thyroid gland, and parathyroid, PTH, regulate bone remodeling and mineralization of calcium. Calcitonin and PTH also regulate calcium through effects on the kidneys and GI tract. Vitamin D is a fat-soluble vitamin. In conjunction with PTH, it controls the absorption of calcium from the intestines and increases calcium and phosphate absorption in the kidneys. Joints are basically made up of cartilage. They're interesting because they have no blood supply or nerves. They are a tough connective type tissue, and there are three types. Hyaline is the most common, and it is also the weakest, and it is found on weight-bearing joints and long bones and the ribs. The diffusion between the chondrocytes allows for exchange of the nutrients and waste, and that's like part of the covering of the joints. Joints are classified by the degree of movement. Synovial joints are lubricated by synovial fluid. They have a joint capsule where the bones meet. They are covered by ligaments dense in connective bones. For example, the shoulder joint. Amphithrosis are slightly movable bones, and examples of that would be the spine and the intercerebral cushions. The inner portion serves as a gel cushion. And finally, we have the syntheroes, which are immovable joints, which include the skull. The skull is kept together by interlocking joints at the sutures and fontanelles. Another example of this would be the pubic symphysis. Now we're going to talk a little bit about muscles. There are three types of muscles. Skeletal muscle make up 40% of the body weight, and they have voluntary control. Smooth muscle line the walls of hollow organs and tubes. For example, the eyes have a muscle that they sit in. These have involuntary movements and control their work is controlled without conscious control from the brain. The heart muscle is obviously involuntary and is not controlled by the brain either. Muscles attached to the bone with tendons, and tendons are dense connective tissues. These muscles play a key role in movement and work in groups to produce smooth muscle movements. As far as the anatomy and physiology, skeletal muscles are composed of muscle fibers, connective tissue, blood vessels, and nerves. Each cell is a cylinder shape with two types of microfilaments. One is actin, and this causes muscle contraction, cellular movement, and maintains cellular shape. The other myofibrillin is called myosin, and this is darker and thicker than the actin, and its job is to form actomyosin. As we age, the number of muscle fibers decrease. With less and the less frequently we use them, the muscles continue to quickly decline. Their efficiency also desecrates over time, but again, it's very dependent on someone's physical activity, level of conditioning, and the degeneration of muscles starts at age 50. But again, if you're in good shape, that is less likely to be as fast as someone who lives a sedentary lifestyle. Now we're going to go over some of the disorders related to the musculoskeletal system. We're going to start with congenital and developmental muscular system disorders. Developmental hip dysplasia is a result of abnormal acetabular and proximal femur development, is more common in females, and the risk factors include the fetus being in a breech position in the third trimester, and after birth, it can happen because of excessively tight swaddling. Prior to 12 months old, the clinical manifestations include hip instability and asymmetric legs. They may also have limited hip abduction, and note that one femur is shorter than the other. If they're older than 12 months with walking, you may notice that they have an altered gait, as in the one leg is shorter, so they walk with a limp, have excessive lordosis, and they may also have a greater trochanter that is prominent. All these changes happen because there are changes in the shape of the femoral head and the acetabulum. The treatment involves reducing the femoral head. If it is noticed earlier in life, it's unlikely to have long-term effects. From birth to age 6 months old, it's usually diagnosed by ultrasound, and then after that, it's diagnosed by X-ray. Reducing the femoral head can be done via splinting, a closed or open reduction. They may have to wear a brace and have physical therapy. Spinal deviations or abnormal curvatures of the spine. Scoliosis is where there's a lateral deviation of the spine. It is more common in females. And on these females, you may notice uneven shoulders or a rib hump as the vertebra rotate. So you kind of see like that shoulder and rib go up on one side as the spine curves the other way. In lordosis, there is an exaggerated concave of the lumbar spine. That lumbar spine is going in further. And in adults, it's common in adults who are obese and are pregnant. Kyphosis is the increased curvature of the thoracic spine, and that might be what you would think of like a hunchback, where they get that bump on the top half of their spine. This is more common as we age as a result of osteoporosis, but this is also secondary to degenerative joint disease and injury. Clinical manifestations include hip and shoulder misalignment. There's also misalignment between the thoracic cage and the gait. These people can complain of back pain and fatigue, and in serious cases may have respiratory compromise. Diagnosis is made by physical exam first, generally, and then spinal x-rays. Treatments include exercises through physical therapy, analgesias, a spinal bracing, and surgical correction if needed. Oh, I'm going to go back to the osteogenic imperfecta. Sorry about that. I had my slides reversed. Osteogenesis imperfecta is what you might know as, quote, brittle bone disorder. It is an inherited disorder, and it's a connective tissue disorder which results in very fragile bones. It is also noticed early in life because these children have excessive or atypical bone fractures, sometimes over 100, and they're kind of weird fractures. And the effects are that you see on them are from bone disorders. They may also have nerves that are compromised, neurological symptoms. They may have short neck, a cervical spine, motion limitations, restrictive lung disease, heart and aortic abnormalities, hearing loss, or dwarfism. Diagnosis is made by history and physical and molecular gene testing. The thing I do want to just point out to you is if someone, and we're going to talk about child abuse, but if you're in an urgent care or an emergency room, or you're in a family practice office or a pediatric office, and someone comes in with a lot of bruises, child abuse is one of the things that we always think of first, but remember there are some other things you need to consider before you get to that point as well. You want to make sure you rule out any pathological reasons for the bruising or the broken bones that these little ones might have. Treatment includes bisphosphonate therapy, which prevents bone reabsorption, and it makes the bone and it prevents the bone turnover, so they don't break and last a little longer. The main goal of treatment is to limit the chronic pain that they have and maintain their functional ability. They may have to have surgery. They may have physical therapy, and their life expectancy varies. I've seen people live with it a long time, and then other people do not live with it a long time. So very variable. So we talked about the spinal deviations. Next, we're going to talk about fractures. Fractures break. The fractures are hard. Remember, they're a rigid structure. So when there is stress applied to those bones, the stress is greater than the bone strength. There are 4 different kinds of fractures, and there's a nice table with some pictures on page 589, figure 1219. A simple fracture is a single break in the bone, and the bone maintains alignment and positioning. A communicated fracture is where there are multiple fractures lines and the bone is in pieces. A green stick fracture is where there's an incomplete fracture. The inside of the bone is intact, but one of the outer layers may be broken. This is common in children and tends to heal relatively quickly. As you won't see this fracture in adult. And compression fracture is where a bone is crushed and in small pieces. And the treatment of those fractures really depends on what kind it is. Complications from fractures include compartment syndrome, which is an increase in a compartment around the injured joint. It impinges the nerves and blood supply and endangers the limb. That is a surgical emergency. They're also at higher risk for fat embolism, especially if the break are in the long bones or the pelvic fractures. This allows fat to enter the blood, and if it travels to the lungs, brain, or heart, it will be a fatal outcome. And osteonecrosis is AVN. That's basically where part of the bone is damaged, but not the whole. Part of the bone, quote unquote, dies or gets necrotic, but not the whole thing. Clinical manifestations include deformities, site swelling, limb immobility, crepitus, pain. It could really be, you could have a bone hanging out of a leg. It can really be very variable depending on the type of fracture that it is. The diagnosis is made through history and physical exam and x-rays. And you also want to, if there was some kind of trauma or an accident, you want to know the specifics of how it happened so you can decide which kind of fracture they're more higher risk for. Treatment includes immobilization. Sometimes if you have a simple fracture, where there's only a single break in the bone, but the bone is in alignment and maintains its position, sometimes all you need is immobilization for 6 to 8 weeks, and that will heal on its own. Other times, if a bone is communicated, like if you fall and you land on a hip, when you hear, if you're working and you hear them say patient has a communicated fracture and they're going to go to the OR, that means there are several fractures in that hip and they're going to take them to the OR to stabilize it, because that will not repair on its own. So whether they require mobilization or surgical repair, these folks will require pain control and physical therapy. Dislocation can happen at any time after a trauma. It generally just does not happen to people unless they have some kind of congenital disorder. But I have seen dislocations in hips and shoulders after people have had them replaced. That can happen. A dislocation is the separation of two bones within a joint. You may notice with these that they have a discolored area, deformities, a visible abnormal joint. They will have limited movement, swelling and bruising, and intense pain. Diagnosis is made by history and physical. Probably start with some basic x-rays and then, if needed, an MRI. Treatment includes immobilization, joint reduction, PSA's pain control, and rehabilitation. Sprains are an injury to a ligament, and these happen when the ligament is forced to move in an unnatural position. It often involves stretching or tearing. The clinical manifestations of this include pain, joint stiffness, limited function, disability, difficulty with bearing weight, and discoloration. Treatment is done by history and physical exam. And if someone has a joint and like you're in urgent care and you can't tell if it's a fracture or a sprain, you may actually even x-ray them to see if there is a break. But generally you can make the diagnosis just by history and physical exam. Treatment includes ice, immobilization, elevation, rest, NSAIDs, and rehab. Strain is an injury to the muscle or tendon that is within the myotendious joint. This is what we would refer to as a, quote, pulled muscle. This often involves stretching or tearing from overuse. Clinical manifestations include pain, stiffness, difficulty moving affected muscle, skin discoloration, and edema. Diagnosis can be made by history and physical exam, MRI, and ultrasound. Treatment is similar to that of sprains. Immobilization, ice, elevation, rest, NSAIDs, and rehabilitation. Unfortunately, we have to talk about child abuse in Pennsylvania and whatever state you're in. All states, healthcare providers are mandatory reporters. Even if you're unclear, you can still report it, and then the authorities can decide if it is in need of investigation. 1 in 4 children are neglected or abused in the United States. The suspicion for the circumstances of physical abuse, most likely between the ages of 3 and 12, includes soft tissue injuries, followed by fractures that are really unexplained. In the history, generally, the parent and the child will deny any trauma. There might be inconsistency with the story. There may be suspicious explanations or behaviors. Remember, another thing is when people avoid eye contact or the child avoids eye contact, or if the child looks at the parent kind of in a weird way, like asking for permission to answer the question. In physical examination, you may see bruising, bite marks, oral injuries, burns, fractures. Again, it's the same diagnosis and treatment for other traumatic injuries. The first thing is to stabilize the child and make sure, their injuries are taken care of. And then Think about some of the other things we talked about, like bleeding disorders or muscle disorders or things like that. But if you have thought of all those things and ruled it out and you're suspicious of child abuse, remember you're a mandatory reporter. Bursitis is an inflammation of a fluid-filled joint. It's a sac-like structure that offers cushioning to the joint. There are 3 types: acute and chronic bursitis. Acute means it happens suddenly. Chronic can mean like a chronic tennis elbow that you might get if you play a sport a lot, or like an overuse type of injury. Septic bursitis is when an infection actually enters that joint. This will be made by history and physical exam. You may also notice some redness at the site and pain at the site. Treatment includes pain relief, healing promotion, and prevention. If someone does have a septic joint bursitis, that generally needs to be aspirated, get a sample out of it and find out what the cultures are, and get them on some IV antibiotics, which is usually done in the hospital. So if you have someone you suspect has a septic bursitis, you'd probably send them to the emergency room from the hospital. Shoulder injuries, there are 2. We are going to talk about adhesive capsulitis. That's an idiopathic. Remember, idiopathic, we don't know why. Loss of active or passive range of motion. It presents as severe diffuse pain. Shoulder impingement syndrome is when there's compression of the structures around the genohumeral joint with shoulder elevation. It often develops because of repetitive work or sports activities. Treatment, again, the mainstay of treatment for bone and muscle injuries is rest, elevation, ice, and rehabilitation. Wrist injuries include carpal tunnel syndrome, which is compression of the medium nerve within the carpal tunnel. It manifests as pain or paresthesias that is worse at night. It is common in women who are pregnant and in someone who is obese, although anyone can get it. Sometimes it's an overuse injury as well from typing. De Quervain's tendinopathy is a common cause of wrist injuries in adults. It involves the wrist tendon on the radial side, and it manifests itself as swelling or pain on the distal radial side. Hand injuries, we have Dupuytren's contracture. This is a thickening and contracture of the palmar fascia. There is a fibroblast proliferation and abnormal collagen deposits. With a trigger finger, there is abnormal thickening of the flexor tendon at the metacarpophalangeal joint. This manifests itself as pain or catching while flexing. Some of these injuries we've talked about around the hand and the wrist, if basic treatments don't work, like the ice, elevation, rest, and therapy, sometimes they may be amenable to surgical intervention as well. And that would be done by a hand surgeon. Lower back pain is one of the most common reasons that people visit urgent care and seek attention of their primary care provider. There are mechanical versus non-mechanical issues. It can come from a variety of different things. There can be disc issues, herniated vertebral disc. It can be a spondylolysis or a spondylolisthesis, which is weakening of the bones, or the bones develop some overgrowth. There can be spinal stenosis, which is where there's a narrowing of the spinal canal. The manifestations really depend on the cause and the effects of the surrounding tissues. Radiculopathy is when the patient has a numbness and tingling associated with the low back pain. And sciatica is again caused by manifestations surrounding the tissue. Serious underlying back disorders include quad equina, which is where someone has had a traumatic injury and they lose control of their bowel and their bladder. There could be a spinal infection, metastatic cancer, or tumors. In general, you're going to find people who have low back pain from work. We're all nurses. We all have low back pain at some point in our life. And overuse, it may be in patients who are obese or have a family history towards osteoarthritis. Diagnosis can be made by history and physical exam. You may obtain spinal x-rays, CAT scans, or MRIs, depending on what exactly you're trying to rule out. Other things that can help with the diagnosis include a nerve conduction study, a myelogram, and an electromyelogram, and that helps with seeing the muscle activity with the muscle, which is the nerve activity of the muscle. Treatment includes analgesias, NSAIDs, muscle relaxers, physical therapy, heat or cold application, and traction. You may also, if it's a chronic back pain, refer them to the chiropractor, or they may also, at some point, if the pain is that bad, need spinal surgery. Osteoporosis is progressive loss of bone strength due to a low bone mass and quality. People that develop osteoporosis have an increased risk for fractures. This means that there is an imbalance between the osteoblastic and the osteoclast activities. Factors that affect this are aging. Remember, we talked about the vitamin D absorption, and we also talked about women after they go through menopause, that they develop a deficiency in estrogen and androgen, which help with repairing bones. There are different types of bone density and structures. Generally, osteoporosis is first manifested as a fracture. Someone will fall, they'll break something, and then when they look at the x-rays, they notice the osteoporosis. There could also be skeletal deformities or kyphosis. Diagnosis is made by history and physical exam, and a DEXA scan could also be ordered. There's also diagnosed specific criteria from WHO and T and Z scores, but you will not be responsible for those. There is a screening tool for at-risk patients, and that's usually built into your EMR when you are in primary care. Treatment includes proper nutrition, behavior and lifestyle changes, pharmacological therapies such as the bisphosphonates. You may also recommend supplementation with calcium and vitamin D. Rickets is a softening and weakening of the bone. There are extreme vitamin D, calcium, and phosphate deficiencies. In osteomalacia, there are deficient mineralizations affecting the bone matrix. Manifestations of these are similar. They may have delayed fontanelle closure as children, cranial tabs, skeletal deformities, fractured, or they may have delayed growth or motor development. History diagnosis is made by history and physical exam serial mineral levels of the vitamin D, calcium, and phosphate. You may also obtain x-rays in a bone density study. This is often identified first in childhood. Treatment includes providing the deficient minerals, good dietary intake and supplementation, and they may need positioning or bracing or surgery to fix the deformities. Paget's disease is an abnormal bone destruction and remodeling. Clinical manifestations include bone pain, skeletal deformities, fractures, headache, hearing or vision loss, and neck pain. Remember, this is in people that also have a low vitamin D and calcium levels. Diagnosis is made by history and physical exam, x-rays, a bone scan, and laboratory studies. Pharmacological treatment includes pharmacological agents, calcium and vitamin D supplementation, and surgical management. Osteoarthritis is a localized joint disease characterized by deterioration of the articulating cartilage or underlying bone. There can also be a bony overgrowth. Clinical manifestations of this include joint pain and tenderness, stiffness, limited joint range of motion, enlarged or hard joints, and crepitus. Diagnosis is usually made by history and physical. You can also do x-rays or MRI. Treatment includes physical therapy, weight management, as it's common in obese people, ambulatory aids, orthopedic devices, and pharmacological agents. They may need surgical intervention as well, and this would be what we would treat for like a hip replacement or a knee replacement. These folks develop osteoarthritis that is not respond to other conservative treatments. Rheumatoid arthritis is a systemic autoimmune condition involving multiple joints. Its classic manifestations include pain, stiffness, and swelling of several joints in a symmetrical pattern. It has characteristics of remission and exacerbation, so it kind of goes back and forth. Diagnosis is made by history and physical exam, serum rheumatoid factors, and anti-CCP antibodies. Those are rheumatoid factors, and other blood tests. Treatments are complex. You'll learn a little bit about those further in the course, but there are, they often need physical therapy, pain management, and sometimes agents to help with the arthritis and the coping of that. Juvenile idiopathic arthritis. It's a category of childhood arthritis, but there is no relationship to rheumatoid arthritis. Its major clinical manifestation is synovial thickening and fluid accumulation. Diagnosis is similar and treatment are similar to the other arthritises we have talked about. Gout is where there's an inflammatory disease from deposits of uric acid. Clinical manifestations of this include pain at the joint, joint warmth, redness, pain and swelling, and fever. You may see people on allopurinol to fight this. And the one thing I'll tell you is if you have a patient who has gout and it doesn't exactly look like classic gout, but they tell you it's their gout, sometimes they know or they can feel the exacerbation coming on. But it can be quite painful and limit their functional status. So diagnosis is made by history and physical, serum and uric acid levels, synovial fluid analysis. What that means is you may tap the joint to get a sample of the fluid, and joint x-rays. Treatment focuses on lowering uric acid levels. Again, they may be maintained on allopurinol, but you may use some steroids for an acute exacerbation. Ankylosing spondylitis is a progressive inflammatory disorder. It affects the sacroiliac joints, intervertebral spaces, and costiovertebral joints. The clinical manifestations include the 5 characteristics of inflammatory back pain, pain in the other joints, muscles, spasms, fatigue, and weight loss. Diagnosis is made by history and physical exam, laboratory tests, and imaging studies. Remember, you're usually always going to start with an x-ray, and then based on what you find, move to a CAT scan or an MRI. An MRI is really the best thing after an x-ray. Although you may know they need an MRI to get to the final diagnosis, in the outpatient world, you may need to actually order an x-ray first so their insurance will cover the MRI. So just keep that in mind for going forward. Treatment includes NSAIDs, muscle relaxers, physical therapy, and sometimes surgical repair. Lifestyle, it's also important for lifestyle and behavior changes, coping strategies, and support. Muscular dystrophy is an inherited non-inflammatory disorder that is characterized by skeletal muscle degeneration. There are many different forms. In general, These folks have intellectual disabilities, muscle weakness, muscle spasms, drool. They generally cannot walk. Diagnosis includes history, physical exam, and muscle biopsy. Treatment includes physical therapy, nutritional therapy. Sometimes they have to be fed by a feeding tube, and muscle relaxants. Next, we have fibromyalgia, which is characterized by widespread muscular pains and fatigue. There are different pain spots that you can notice. And if you have so many of those pain spots, your diagnosis is fibromyalgia if you've ruled out all other causes. Clinical manifestations do vary on the weather, stress, and fatigue level, physical activity, and the time of day. The classification criteria is again made by pointing out the trigger spots. Lifestyle treatments include lifestyle, behavioral changes, heat application, massage therapies, acupuncture, analgesics, and antidepressants. Specifically, Cymbalta is very good for decreasing the pain of fibromyalgia. And it's also one of the indications for, it has an indication to treat fibromyalgia. Bone and muscle neoplasms, these are the names of them just to be familiar with them. Again, you'll probably find these on physical exam or x-rays, and treatment would be done in conjunction with a local oncologist. Thank you.